Good morning, everyone, and thank you for joining us today. My name is Dr. Wajid Ahmed, and I'm the Medical Officer of Health for Windsor-Essex County. Teresa Meritet, our CEO, is not here today due to other competing priorities. I'll start with our case counts. Today, we are reporting a total of 10,278 cases, an increase of 288 cases from yesterday. We have 2,812 cases that are active at the moment. 7,229 cases have resolved. We are reporting 237 deaths in total today, an increase of 11 new deaths from yesterday. 9 are from the long-term care home, a man in his 60s, 4 women and a man in their 80s, 2 women and a man in their 90s. 2 deaths are coming from the community, a woman in her 50s, and a man in his 70s. There are 45 active outbreaks in Windsor-Essex. 21 are still in the long-term care home and retirement home, 19 workplaces, and 2 hospital outbreaks. As we continue to roll out the vaccine and we continue to provide more details, I wanted to take this opportunity to talk more about the direction, the plan that's coming down from the province and what's happening in Windsor and Essex. So I have a PowerPoint slide that I would use today. Starting off with the different phases of vaccine rollout as we have seen and heard from the province and even from the health unit. Phase 1 started off with targeting the high-risk population. It started in December 14th in Ontario. It started off with limited vaccine supply. The target is to make sure that the high-risk population with a high burden of illness and high likelihood of developing more severe complications, they are prioritized in phase 1. We expect that phase 1 to last all the way up from December to maybe sometime in February and March. Phase 2 is the timeline when we're looking for that would target more broadly and have many mass vaccination clinics. And it is expected to start sometime around March, April 2021, when we start to see significant and steady increase in vaccine supply, not only in Windsor-Essex, but throughout the country. And then we will be talking about the phase 3, which is a steady state, which means that everyone who is interested in getting the vaccine and were ready, prepared, got their vaccination, but then we still need some people who will be coming in and leaving and require some additional vaccines or some catch-up. That is expected to start in September 21. So we have a huge task between now and up until the August to make sure that we are vaccinating the majority of the people in Windsor-Essex, and from the provincial perspective, they want to vaccinate everyone by the end of that timeline as well. So looking at what vaccines we have at this time in Canada, right now there are 2 vaccines that are currently approved in Canada, and obviously the first one is the Pfizer-BioNTech vaccine. It requires an ultra-cold temperature for storage and cold chain maintenance. It requires a minus 70 degrees centigrade freezers. It comes in 5-dose vial that must be used within 6 hours, and that is critical. So by the time when all of these vaccination clinics are set up, these vials should be ready. It needs to be reconstituted, and it needs to go into the inoculation for people. It requires 2 doses of the vaccine spread apart at least 21 days interval to show its maximum effectiveness. Pfizer-BioNTech vaccines, based on the clinical trial, have shown to be 94% effective, and it's indicated for 16 years and older people. And then the second vaccine that is approved in Canada is called Moderna, and it is relatively stable compared to the Pfizer-BioNTech vaccine, and it requires a minus 25 degrees temperature to store. And then it comes in a 10-dose vial, which makes it a little bit more challenging, because once you open the 10-dose vial, then you need to get all those 10 doses into people within 6 hours. Otherwise, the vaccine is no longer good. So there are some pros and cons in both of these vaccines when we're talking about a single-dose vial versus multi-dose vial, and how it plays into any of the operational logistics of it. It also requires, similar to Pfizer-BioNTech, 2 doses that are spread at least 28 days interval, and it is indicated for anyone who's 18 years and older. When I'm saying indicated for 18 years and older, the critical piece is all of that is based on the clinical trial that was done, and the population that it was done on. Doesn't mean that it will not be effective, but we don't have enough data from the company clinical trial to indicate if this is the age group that it would show some effectiveness or benefit. So the more and more data is coming, and we are anticipating that we will get more clinical data directly coming in from the company to anyone who is not indicated at this timeline about the effectiveness and the utility of these vaccines in that age group. So moving further, there are at least 2 other vaccines that are currently being reviewed in Canada, and the first one is AstraZeneca-based vaccine. It's an adenovirus-based vaccine, and the last 2 ones are the messenger RNA vaccine, which is a newer type of vaccine. So this is generally the vaccine that have been used in other type of vaccine as well. The vaccine is currently approved in UK, but it's currently looked at in Canada and has not been approved yet. It also requires 2 doses, which are spread apart between 4 to 12 weeks. So we have more timeline in terms to administer the second dose. It is also indicated for anyone who's 18 years and older. The good thing about AstraZeneca vaccine is that it can be stored in normal fridge. The 2 vaccine, the mRNA-based vaccine, it has challenges in terms of storage and then the cold chain maintenance. AstraZeneca vaccine can be stored in normal fridges, which many of our hospitals, our healthcare providers normally have, and it uses the same fridge to store and vaccinate people. AstraZeneca also comes in either an 8-dose vial or a 10-dose vial, and similar to the other vaccine, once opened, it must be used within the 6 hours. Then the other vaccine that is currently being reviewed is the vaccine from J&J, and it's also an adenovirus-based virus-based vaccine. And right now it's in the final stages of providing clinical data, and it has not been approved anywhere in the world yet. So they are waiting for the final trial result, and when it's available, depending on which country reviews it first and give their go-ahead after talking to all the regulators across the country. The important consideration for J&J vaccine, it's a 1-dose vaccine so far. They're also looking at the utility of the second dose, but so far they're using a 1-dose vaccine. So from a logistic perspective, it's much more easier vaccine to administer if it uses the same fridge, and also not having to come back for a second dose in a timely manner. So that's why there's a lot of interest in that particular vaccine too. When we're talking about now these 2 vaccines, what is the role and responsibility for various entities that are involved in the mass immunization and vaccine rollout in Windsor-Essex, and also all the way from different levels of government? So within Ontario, the Ministry of Health obviously set the priorities, they set the target, and then their job is to ensure that the healthcare system is supported. So all the priorities that we are seeing, that who gets the first dose, who gets the second dose, who gets the third dose, these are all high-level priorities that is coming all the way directly from the Ministry of Health. And then at the local level, public health unit level, we are the lead in providing the local vaccination program in partnership with our health and municipal sector partners. So as we know that right now with the 2 vaccine, we are working very closely with Windsor Regional Hospital for them to deliver the Pfizer vaccine, which requires the ultra cold temperature, and they are rolling it out into the priority population that has been identified by the ministry, and working in consultation with public health to make sure that it's getting to the right people. And then from the health unit side, obviously, we are working on the Moderna distribution based on the priorities as well. And then also to ensure that we are working with all the key players in the region to get together to not only roll out the vaccine today, but also what it would look like as we get more and more vaccine in the region. And the other critical piece for public health is to establish committees on prioritization on what is already identified as a priority. So we're talking about the sub-prioritization, and and ensuring that all those sub-prioritization criteria and matrix are fulfilled based on the guidance that currently exist. And then the other roles are from Ontario Health to support the vaccination program with coordination with other local health system partners, because as we mentioned, right now it's the hospital and the public health units that are directly involved in it, but as we get more and more vaccine, we need a lot more health system partners to get engaged in the distribution and delivery of all these vaccines. And then there are association, unions, and colleges which are working directly with the Ministry of Health and the public health units to support vaccination of their members and also their attendees of different institutions that we are talking about. And then as a healthcare worker or an essential worker or any type of worker, the responsibilities for them is to participate in the immunization campaign as the vaccinators and also as the recipients of the vaccine, and to support the various aspects of immunization, all the way from counseling the patients, addressing patients' concern, and combating any myths, and talk more about the vaccine uptake and dispel any concern that many community members may have. So in Windsor-Essex, what we did, we put together a vaccine rollout committee, identifying various leads and understanding that it needs to be a tight group to make sure that we are covering all the critical pieces of the vaccine rollout and having all those timely discussion in a very structured way so that we can follow the path and get that high level plan in place, and then followed by that high level plan, all the different components of planning and the operation and the logistics of all of that can be put together in one place. So as identified by the ministry, roles and responsibility of the vaccine COVID rollout, so obviously that makes Windsor-Essex County Health Unit as the lead in the vaccine rollout in the county. And then we also needed to work with the municipal partners, and that's why we have these local political leads to support the vaccine rollout using municipal infrastructure and other supports, recognizing that we cannot possibly include all the local politicians. So there has to be some mindful key politicians that we can include in numbers to represent the fine balance between the county and the city and the population that they serve, and to provide that municipal liaison and municipal lead for this vaccine rollout. And then the third important partner is our hospital sector leads, to make sure that our hospitals are engaged in the vaccine rollout, as we can see that especially with Pfizer being on the vaccine that we have a significant supply, and as we heard yesterday as well, the government of Canada also bought additional doses of Pfizer vaccine, and recognizing the challenges of storing these vaccine in an ultra cold temperature, and also in terms of reconstituting the vaccine, it does require that precision and that healthcare oversight to ensure that these vaccines are effective and are getting prepared and going into the people in the most efficient way. So we definitely see the hospital continuing on with that, not only just for the actual administration and delivery of the vaccine, but also in terms of coordinating many of the responses, coordinating many of the mass immunization clinic as we continue to work on that. And then we also need to include our first responders lead, and first responders, when I'm talking about first responder, that includes everyone, including the EMS, the police, the fire, and anyone else who is responding to any kind of emergencies, and to ensure that they are coordinated well with the various aspects of vaccine rollout, whether we are talking about human resources in terms of actually vaccinators or EMS or paramedics giving out the vaccine, but also in terms of any type of emergency response, any kind of immediate reaction or to the vaccine that is needed. When we're talking about the security aspects of the mass vaccination clinic, the traffic flow and all of those things. So we need those first responders lead to present that type of perspective in the vaccine rollout. And then we also know that, despite all of that, we still need many more people rolling out the vaccine, and that's why we have the non-hospital based physician lead to coordinate with the non-hospital based physician in the area, primary care, family medicine, family health team, and all those groups to come together to ensure that the vaccines are rolled out through their channels, either in as I said, in a form of a mass vaccination clinic, or either through their individual clinic located across the county. And that also includes the pharmacist as well, because we know that the pharmacists are used to delivering the flu vaccine, and they deliver the vaccine in large numbers every year. So we want to leverage that, what existing infrastructure is there, and to build up on their capacity to continue on with these vaccine rollout when we start to get more and more vaccine. Right now, the vaccine that we currently have, obviously it does require, it is limited quantity, and it does require a lot of logistical challenges to make sure that the vaccine stays, follow all the protocols. So that's why we still need their partnership, but they're not distributing it right now, but they will eventually all come together. And then we needed to work with the post-secondary education system, recognizing that we have lots of students, staff, volunteers that we need, nursing student volunteers, other type of volunteers, and support and logistics in various aspects of this vaccine rollout. So we have representation from there. We have representation from Indigenous leads to represent the Indigenous population in our committee, and then the home and community care. We have a significant proportion of people who are receiving home care due to various reasons, and getting the vaccine to those people who are chronically ill or who are receiving chronic home care. The inclusion of or the perspective of having the home and community care representative in that committee would bring in the additional component of the vaccine rollout to the key priority population. So this is what the overall picture looks like, and this is somewhat complementing to what the provincial plan timeline looks like with the various aspects of the different phases of the vaccine rollout. And as we can see, the phase 1 is targeted to high-risk population, and when we are focusing closely on what this priority population looks like in terms of numbers for Windsor-Essex, and what we can see is in Windsor-Essex, we have roughly around 10,000 people that needs vaccine who are living in the congregate living settings for seniors, and that includes the retirement home residents, long-term care home residents, staff, essential caregiver, and other employees that work in that setting. So we have roughly 10,000 people who are in that category, and if all of them receive the vaccine, we need 10,000 doses multiplied by 2, which is 20,000 doses to vaccinate just this group of people. And then the other priority that's identified in the provincial plan, the higher level priority, is the healthcare workers. So roughly in our region, we have 11,000 healthcare workers, which requires vaccination. And then all of these 11,000 workers, they work all the way from the ICU all the way down to clinics providing virtual care or any other type of healthcare services. And similarly, we have the adults in the first nation priority, et cetera, et cetera. So this is just to give you an overall layout. And then when we're talking about the vaccination sites modeled and the priority population served, we have 3 major mode of vaccine delivery, starting all the way from public health units, leading the teams, as well as organizing the mass immunization sites, and then working with other partners to staff those mass immunization sites and give the vaccine out. And then the second mode of distribution continues to be with the hospital-based clinic, and then the hospital-based clinic is still serving some of the key priorities, as we can see. And then lastly, we also will have the on-site clinic as well as mobile teams serving the various priority population, adults receiving home care, and health equity-based clinics, priority population, priority neighborhoods, primary care providers, pharmacy-based clinic. So there are all different types of clinics that would start to come into play at different phases, depending on the vaccine supply and vaccine distribution in the region. So current priorities, as we have talked about, is the long-term care homes, retirement home residents, staff, and caregivers. and then the healthcare workers based on the prioritization framework. So, and we talked about that there are roughly 11,000 healthcare workers in the region. So what does it look like? Who are they, and how they can get their prioritization? So the ministry has released their guidance to further on the healthcare worker prioritization piece, and going through all the different element of how it's structured and how who are the priorities and how we can get to those priorities. We need to I wanted to share that. So from the top, it starts off from acute care and other hospital settings, and then followed by the congregate care settings staff, and then followed by community care with high risk exposure of and serving specialized population, healthcare services for Indigenous population, community care where there's a high risk of exposure. That means there's a high likelihood that you would be coming across patients with COVID, but you're still serving the general population. And then you have the laboratory services that are going in to collect specimens in various high risk settings. And then you have public health staff that are directly working with COVID. And then you have COVID vaccination clinic staff that are working in the community or in any different settings. And then under the secondary prioritization, we have community care with lower risk of exposure and serving special population. And so essentially that means that, this is the group that are working. They have a low likelihood of seeing someone with COVID positive, but they're still serving a vulnerable population. And then you have other low risk population, the low risk exposure that are serving the general population. And then you have non-acute rehabilitation and therapy, and then public health, all other public health staff that would go under this primary and secondary prioritization. So those are the prioritization lists that are provided by the province. And as we can imagine, despite all of these criteria that we have identified about the primary prioritization and secondary prioritization, it's complex. And according to the ministry's plan, we do have public health have the responsibility to put together a committee, a prioritization committee, to make sure that we are following all the ethical guidelines, applying all the ethical principles and equity-based principle to ensure the vaccine delivery, especially when the vaccine supplies are low. So we want to make sure that the vaccine is going to the right people at the right time, rather than wasting some of these doses and creating a concern in the community that who's getting the vaccine and who's not getting the vaccine. So ensuring that we are all aligned. We have put together a committee with representation from various sectors, and we will have our meeting shortly to work on some of these priorities, to have some consistency in how we were doing it. Some of the membership that we are including in our prioritization committee is including a bioethicist from the university. We are getting some representation from the first responders. We are getting some representation from the health sector. We are getting some representation from people from an agency that works with vulnerable population. We are also working with someone who is working with the marginalized newcomer immigrant population in the region. So having this committee will help us to set up some clear direction, clear prioritization, which is based on the ethical principle and applying the local lens and to every decision making that we are doing. It would help us to identify communities that with a high prevalence of COVID-19. It would identify communities at risk due to structural factors and considering the determinants of health. So we'll be pulling together all that information in one piece, and to ensure that we are following a certain methodology to ensure that the vaccine's prioritization is happening at the right time. So I'll stop there. I know I talked a lot today. Happy to take questions on this very important topic.
We'll now take questions from the media. Today we'll start with Blackburn.
Hi, good morning. I guess start off with a different topic. The Ontario government announced some new restrictions yesterday, obviously, but they're still causing some confusion with people just, the non-essential businesses are allowed to stay open for curbside. They have shortened hours. Some of the direction is to stay home order. What is your view on the order? Did they go far enough?
Well, I think I'll have to look at the actual piece of legislation. To my understanding, that they're still working on those details and ensuring that it covers the various concern that was raised by the public health officials and based on what the epidemiological data is suggesting. So I would wait for the actual legislation before jumping into conclusion at this time, but it is important that we get the basic message. The basic message is stay home, stay safe. So that's the message that I think is loud and clear. And anything that is added on top of it is just to compensate and to find the right balance in terms of ensuring the needs of the basic needs of anyone who is living in a community and protecting the health and well-being of the community.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. So you spoke a lot about the vaccine today. Can you reiterate your confidence in the health unit's ability to lead this massive vaccine rollout?
Well, I think the vaccination rollout is a critical piece that many people associate public health with. So even as a child growing up, it's a lot easy to say, yeah, vaccines, public health. So we know that this has been our role right from the inception of the entire concept of public health. But as I alluded to, it is a massive undertaking, and we do require all that support that we need. We have done many of this type of work in the past, but what we are talking about is an ongoing task of looking at vaccinating roughly around 4,000 to 8,000 people a day in the peak season, which is I anticipate sometimes happen April, May, or June timeline. That's the timeline that you would anticipate that much high doses of the vaccine received in the community. And right now, as we know, between Windsor Regional Hospital and the health unit, we are roughly immunizing, I would say, 800 to 1,000 people a day based on the availability of the vaccine. And it can be ramped up. It can be ramped up easily to compensate for at least 1,500 to 2,000 vaccines a day easily. But when we are talking about the large volume, we're talking about 4,000 doses, 5,000 doses a day. And then the whole logistics of ensuring that who's getting the first dose and how they will come back for the second dose, and how accessible these locations are, how many sites we need in the community, and whether these mass vaccination sites would be enough, whether we need to do maybe more priority community-based clinic to get people to the clinic, especially those who are at a higher risk of developing COVID-related complications, but also at a disadvantage for not getting to these locations. So it does require a lot of collaboration, a lot of work. So we see that there's a lot of work ahead of us, and we want to make sure that we all come together and we work in a systematic way, and making sure that we're not moving ahead of ourselves, and getting the planning, getting all the various elements of things together. And as we have showed time and time again, when it comes to actual planning and delivery of anything, whether we are talking about the drive-through testing, whether we are talking about completing the mass testing of the long-term care home and retirement home in the summertime, whether we are talking about the vaccine rollout in the long-term care home, we have shown already that how quickly the health unit takes up on all those pieces, takes all the planning consideration, operationalize it, and deliver it. So we just need to make sure that we're not jumping the gun by trying to answer the question, which doesn't need to be answered right now, but we need to have all that infrastructure, conceptual framework, the clarity in the planning, and the various components, and then start to put together. So I feel pretty confident with my team. I think our team has proven time and time to be delivering what we promised, and we promised whatever we promised, we actually delivered much better. So I don't have any doubt that that there's a chance that we won't be able to do it. I think the key piece is who's coming together to help us do it, and how they're supporting us, and instead of creating more problems or more concerns for us. So I think it will be crucial that we are all in this together and we continue to work together.
Okay, thank you for that. And then switching topics, I see that an outbreak has been declared at Queen Victoria, one of the schools, yes, Queen Victoria Public School. I see that the public board is listing its 3 staff members have tested positive to date on its website. Can you comment on that outbreak?
So Taylor, what happens as we have seen starting in December, we have seen case counts that are really, really high. So even when we had an initial case, it took us a few days to get to the case because of the lab delays. It took us a few days for us from a case investigation perspective to get all the details. And then by the time all of this information is there, and then individuals are isolating, and by the time that the second individual who, based on the first exposure, got sick, that meets the definition of an outbreak. So when that happens, we have to notify that this is an outbreak. It doesn't really matter. It doesn't really mean that there is still an ongoing risk. So some event that happened in the past, we still have to link it together from the epidemiological perspective, and also from a reporting perspective. So when you're seeing some of these reports, these are not an active outbreak at this time, and I think that's the easiest way to explain. This is not an active outbreak. The active outbreak is already over. It's just the purpose of reporting and ensuring that they're all epi-linked. So that's why you're seeing it on our website, and then it will be removed once we get all that information in place.
Okay, so this wouldn't have been a recent transmission between staff members who are still working in the school setting despite in-class learning being over?
That is correct, yes.
Okay, thank you.
Any questions from AM 800?
Dr. Ahmed, in regards to today's confirmed cases, 288, I believe that's a new record for Windsor-Essex. I believe our previous one was 272. What do you think the issue here is in Windsor-Essex? I know we've talked about it, you've talked about a number of times about close contacts, following the procedures, but what's your gut telling you? Why don't you think some people in Windsor-Essex are getting it? What's the problem here?
So I think, Rob, so a couple of issues. So just one clarification. So we're still trying to tease that 288 number down. I think my epidemiologist reported me that some of these data that we're reporting today were misreported before by the lab, and so we're just trying to collate it together so that it is captured into our data. So it not necessarily is the data that came back last night. So there may be some previous reports that was not reported, and then it ended up in getting reported yesterday. So the second part to your question is what's happening in Windsor-Essex. So I think so there are a couple of the concerns. So obviously one is the compliance piece and how people are doing. And again, I respect everyone who is following the public health guidelines, and I can't say thank you enough to them for following that. But also when you're looking at the data that was reported yesterday in terms of the mobility, and 70% of the Windsor-Essex County people were mobile during the holiday season, and which is contrary to what the recommendations were and what the advice were. So clearly there are pieces that people are not taking seriously. And then, as I've said last time, which I think maybe I was not clear, but let me just repeat it again. When someone is thinking that I am doing something in a safer manner because I have considered everything, probably not. Because the key piece is you should not have those type of gathering. You should not have those type of meeting. You should not try to find a way to safely do something. There is no safe way to do something. When you're coming in contact, the likelihood of spread is higher. So I think I'm hopeful with the extended measures that has been put down with a hard lockdown now by the province and by the premier, it should help people stay home and stay safe, would help us bring the case counts down and to save our healthcare system and everyone, save lives. The number of deaths is staggering, and I honestly, I feel really sad every day when I'm seeing that large number of deaths that we are reporting every day. It is a huge concern for our community, and I think we need to understand that public health cannot do it alone. The hospitals, healthcare system cannot do it alone. We need everyone's help to understand that how terrible this virus is, how quickly it spreads, and how it can cause life. Last comment is in terms of when we're talking about the spread easily and on top of all these factors is the possibility of a new strain, a strain that can spread very quickly. We heard about the UK strain, we heard about the South African strain. Is there any other type of mutation that's happening? We don't know. We have asked the lab, they are looking at our data, and they do some of those random checks as well. But so far, right now, I think it's a combination of all of that, and we need everyone to play their part to keep the case counts down.
Thank you. And in regards to more question about the premier making his announcement yesterday, I know you had said you have to look more into it and you want to see the final outcome that comes out today, but it doesn't look like manufacturing facilities are included in that. Has the virus been an issue in manufacturing facilities in Windsor-Essex?
Well, that's a good question. So the challenge with investigation with many times, and I think that's where we have to acknowledge the limitation of of these investigations. So many of these manufacturing places, they have all of these protocols in place. And then, especially in a large manufacturing sector, you would anticipate that people are going into these manufacturing centers and following all the appropriate precautions. But these are also the people who are interacting in the community in various ways. So when you're trying to link the exposure, that how these exposures are contributing to the spread of the disease, then we sometimes we don't have all the details to say with certainty that yeah, that's a workplace exposure, or no, this is not a workplace exposure and this is an exposure that happened from outside. So the accuracy of that workplace exposure continues to be in question, but going back to the basic principles that when we're actually reporting workplaces, so we started reporting workplaces, I think, much more earlier than many of the other areas as well. And the purpose of this identifying these workplaces is to get some of that education going, send our inspectors out in most of these workplaces when we, right now it's a lot. So but we are trying our best to send our inspectors, get all of those things in place to ensure that the workplace, if there's any educational need that we need to do to keep that workplace safe, we do that. But right now, I don't have enough to say that workplaces are a significant source of these outbreaks. Whenever we get a workplace outbreak, we report that. How many cases it results in, it may be underreported than what we actually have in our region and across the province as well.
And sorry, just to follow up to that one, if you notice that there's issues with manufacturing in these facilities, and the province doesn't touch it, could you issue an order similar to the schools to, for example, shut down these facilities for a period of time? Do you have that capacity in your role?
I do, but it has to be an established risk, and I think that's where as much as people think that I have unlimited powers, I don't. It has to be justified based on the risk. And unless I cannot establish that risk, I can't do that. But most of the workplaces that we have worked so far, it never came to the point to issuing an order. Sometimes issuing an order is important to get some of the control measures in place. But other than that, generally the workplaces are compliant. They want to work with us. They want to keep their workplace safe for their employees. They want to keep it open, so they are willing to do everything that is needed to keep it safe, but recognizing that it's not easy.
Thank you.
Any questions from CTV?
morning. Based on the vaccine rollout plan, when will EMS, firefighters, and police officers get the vaccine?
So if you can go back to the slide that I presented, they all fall under the essential workers category, and then the essential workers category rollout is slated to be sometime in the second phase. And again, a lot of these priorities are set up by the province, and we know that that priority is being considered next, and the provincial direction is coming down soon. But again, if you don't have the vaccine, you can't vaccinate them. So it's a combination of both. But I am aware that the province is currently working on that rollout, that how essential workers can get their vaccines.
Okay, thank you. And switching gears, are you worried about the mental health of residents with another lockdown and restrictions?
Well, absolutely. I think the pandemic has its toll on various mental illness, and people are experience a lot more severe impacts if they had any pre-existing mental health concerns, but also from people who may haven't experienced any mental health concerns. So there are all of these issues and concerns that always comes into play when thinking about the lockdown and when thinking about the pandemic itself. And the entire year 2020 has been difficult for everyone, and so we don't need to lose that part, that that it is something that's affecting everyone. And I wanted to make sure that people understand that it's not something, a lost thought on anyone's mind, especially working in public health. And I really hope that the agencies that are responsible for the mental health and well-being, they are stepping up their game to be on top of addressing some of these concerns, because again, this is a global pandemic. Everyone is impacted by it, and we all have our different roles to play in keeping everyone safe, saving lives, and get rid of this pandemic as soon as possible.
Okay, thank you.
Any questions from CBC?
Hi, yes, good morning. I'm just wondering, when it comes to the mass vaccination plan, what stage are you at when it comes to recruiting staff, nurses, volunteers to actually run the vaccine clinics? Because I know that London Health Sciences, for example, they already have calls out for people to participate.
Good question, Katarina. So as I said, right now, between Windsor Regional Hospital and between Public Health, we already have the capacity to vaccinate. The hospitals are supporting some of these retirement home, long-term care home to get some of these vaccines into these facilities. So we are meeting those capacities at this time. When we're talking about these call out for volunteers or other people, I anticipate that would only happen when we don't have the internal capacity to do that right now, and also when we have more vaccine than we can deliver in a timely manner. So we are working with one of our partner that are involved in the vaccine rollout with all of those details. So everything that I presented here, I wanted it to be on in a single place where people can look at the various information, including what phase of the vaccine rollout we are in, who is the priority population, what can you do if you want to volunteer, what can you do if you want to get the vaccine, to have all that pre-registration done and learn more about the vaccine. So all of those details you will see in that resource that we are currently working with one of our partners.
And what about in terms of locations and sites to actually set up these vaccination clinics? Do you already have a couple of sites set up or identified, or how many do you think we'll have across the region? Can you speak to that?
For sure, yeah. So as I said, we are roughly looking at between 4,000 in the usual circumstances, 4,000 doses a day. And then in the extreme circumstances, you are possibly looking at 8,000 vaccines a day. And as I said, between Windsor Regional Hospital and us, we are, without having these mass vaccination clinic, we're talking about roughly 800 to 1,000 vaccines a day. At this time, we have that capacity. But let's say if we have to ramp it up, just with the hospital and the St. Clair College that they're using, they can double the capacity. And then when we're talking about any other type of mass vaccination sites that we need, we can easily get that site up to 1,000 or 1,500 doses a day capacity just in one site. But recognizing that Windsor-Essex is, from a geographical perspective, it's huge. So we need more sites, and some of that conversations with the respective municipalities and their CAOs are happening right now to identify those locations and to get everything that is needed to, simply, turn on the switch and you have the site, turn on the switch and you have the site. And when you're combining it together with the resources or the human resources that's available to vaccinate, and some of the other the logistics that we need, from setting up the clinic perspective, ensuring that the facility is ready with everything that is needed from a security perspective, from a cold chain perspective, from a staffing perspective, then it would be much easier. So right now, all of that work is being done as we speak, and we will have all those details ready even before we start to receive those massive number of doses that will arrive in our community.
And I spoke with a nurse scientist locally who said that it would take her 10 minutes to teach me how to administer a shot myself to somebody who might need it. So I'm wondering at what point are you going to be recruiting your average citizen who just wants to help, or at this point, when you think about the mass vaccinations, are you sticking with healthcare professionals to do the administration?
So at this point,
administering.
Yeah, that's a good question. So at this point, I think we have enough system capacity using our pharmacists, using our primary care providers, using our hospital partners, using our various community health partners to administer the vaccine. So administering the vaccine, you may think that, yeah, it's a simple process, but it does require, it's a delegated act, and it has to be complied under the health regulation. There are a number of considerations that you have to fulfill before anyone can start injecting someone with something. So I don't anticipate that actual task of vaccination will be assigned to someone who's not a healthcare professional. We have lots of capacity, even when we're talking about the nursing students. We have the capacity to talk about the medical students. We have all of those pieces in place, and on top of the actual practitioner too. So I don't anticipate that we would need to train people to give them a shot, but we may need people to do some of the other work. For example, you're going to the mass vaccination clinic. You need to be checked in. You need to be registered. You need to make sure that you are the right person, that you are getting the vaccine. You have completed all the paperwork that is needed. You have completed your consent pieces. You are following all the public health guidelines that would govern how you would come into that clinic and get your shot. And then we may need volunteers to make sure that people are navigating the mass vaccination site in the appropriate manner. We want to make sure that people, if whoever is coming, we have the capacity to educate them to wear the personal protective equipment appropriately. We have the volunteers to make sure that people, after receiving their shot, when they're waiting for their 15 minutes post-vaccination monitoring, we have someone who's monitoring them. We have a team of healthcare professionals who are monitoring them in case of any kind of reaction that may happen. We have healthcare workers on site to answer any questions or concerns on site, because if someone is coming in and say, hey, I have this XYZ disease, I didn't even talk to my doctor. Now I want the vaccine. What do I do? Should I get it? Should I not get it? Or if there's any untoward incident that happens with any reaction, and how are we responding? So there are a number of opportunities for volunteering. I think I'm not concerned about the healthcare worker at this time. Based on what I know, it may change, but based on what I know, we just want to make sure that we are tapping into the resources that are available right now before we move on to the second piece.
Thank you.
Any further questions from Blackburn?
No, thank you.
Windsor Star? AM 800?
Doctor, I have another question from a listener. I'll just read it directly to you. Dr. Ahmed, since parks are still open Can my 13-year-old go play on equipment with a friend so long as social distance and wearing masks are followed? Question mark. I assume yes, given the 5-person limit, but will this fit under the exercise portion of the exemption to the stay-at-home order?
Without seeing the actual language of the legislation, I cannot say. I anticipate, and again, don't take my word for it unless we actually see the legislation. I anticipate that that should be okay, recognizing the risk that many of these playground equipment are not necessarily cleaned and monitored. So as long as people are aware of the potential risk and following the guidelines, it should be okay. But I have to look at the actual legislation before I can say with certainty.
Thank you.
Any further questions from CTV?
No, thank you.
CBC?
Yes, you had previously said that any additional restrictions are up to the province, and now we're seeing this come down from the province. As you say, you want to take a closer look at the legislation. I'm just wondering, after you've done that, would you consider additional restrictions at that point if you feel like it doesn't go far enough for you?
I cannot answer what is covered and what's not covered, but as we have always said that my interest is to keep my community safe as best as possible, which is evidence-based. And if there is any concerns that is more relevant for my community that requires some action, we'll take some action.
Okay, and I have one more question about vaccines. You said you put together a prioritization committee based on ethical principle. And I'm just wondering, it sounds like you haven't had any meetings yet, so I'm just wondering, when did you realize this was necessary and why wasn't it put in place before the vaccines had arrived in our region?
Well, I think we've been getting lots of questions and requests from people, average people, organizations reaching out to us, almost making a case for that why they should get the vaccine. And I feel that while it is important that we address to those concerns, but I also want to make sure that it's not just me, the medical officer of health, making some of those decisions about who is important, who is not important, and what criteria we should use to even further prioritize the risk. So, for example, even if what does it mean if you work with a population, even though you are a healthcare worker, who is in a community that hasn't seen a high rate of COVID cases? But similarly, same worker, if you're working in a high-risk priority community that has seen a highest burden of the COVID cases, and then what kind of benefit that you can consider from one person to another. And how do you do that if you just have, let's say, one dose, whether you go with someone here or whether you go with someone here. So I think that's why it's important that we have some of those processes identified and we have the brightest mind to provide the different perspective, different lens, using some of the ethical principles to make sure that we are not missing anything. We're not creating any divide. We are not creating any confusion in the public on who's getting the vaccine and who's not.
Okay, thank you so much.
Thank you, everyone.